Live oaks are Houston's most iconic trees. These massive, beautiful trees can live hundreds of years and add tremendous value to properties, but they're also vulnerable to specific diseases that can kill them in months if not caught early. Today, I'm walking you through the 5 deadliest diseases killing Houston's live oaks, what symptoms to look for, and what you can do to save your tree before it's too late. Let's start with the absolute worst, most devastating disease affecting live oaks in Texas: oak wilt. This is the disease that keeps Houston arborists up at night because it spreads fast, kills quickly, and can wipe out entire neighborhoods of live oaks. Oak wilt is caused by a fungus called Bacterial that invades the tree's vascular system and essentially clogs the water transport, causing the tree to die of thirst from the inside. Here's what makes oak wilt so terrifying in Houston. It can kill a live oak in as little as 2 to 6 months from infection. It spreads through interconnected root systems, so one infected tree can spread to every oak tree in the neighborhood. It's transmitted by beetles attracted to fresh wounds on oaks. And there's no cure once a tree is infected. Treatment only works as prevention. Symptoms of oak wilt in live oaks start subtly and progress rapidly. Early stage shows leaves on 1 or 2 branches starting to turn brown from the leaf tips inward. You might notice leaves dropping in spring or summer when they should be green and healthy. The pattern is distinctive, called veinal necrosis, where the leaf veins stay green longer while tissue between veins turns brown. Mid-stage shows more branches affected, leaves turning brown and falling in increasing numbers. The tree starts looking thin and unhealthy. Late stage, the entire canopy may be affected, massive leaf drop, branches dying. The tree looks like it's in fall colors, but it's actually dying. At this point, the tree is likely beyond saving. The key to oak wilt is early detection. If you catch it when only 1 or 2 branches show symptoms, treatment might save the tree. Once half the canopy is affected, treatment success rates drop dramatically. If you see any suspicious leaf browning on your Houston live oak during growing season, call a certified arborist immediately for testing. Don't wait to see if it gets worse. By the time you're sure it's oak wilt, it might be too late. Prevention is critical for oak wilt. Never prune or wound live oaks during February through June. This is the active season for the beetles that spread oak wilt. Any fresh cut or wound on an oak during this period attracts beetles that may be carrying the fungus. If storm damage creates wounds during this period, immediately seal all wounds with wound paint or dressing. This is the only situation where wound dressing is recommended. Treat healthy oaks near infected trees with preventive fungicide injections. This creates a barrier in the tree's vascular system. Install root barrier trenches to prevent spread through connected roots. This requires trenching 4 feet deep between infected and healthy trees to sever root connections. If oak wilt is confirmed in your live oak, the infected tree usually must be removed quickly to prevent spread. The wood must be properly disposed of, not left as firewood. Treatment of surrounding oaks must happen immediately. Oak wilt moves fast. The Texas Forest Service has specific protocols for dealing with oak wilt that must be followed. Second major disease killing Houston live oaks: Hypoxylon canker. This is a fungal disease that attacks stressed trees, particularly during and after drought conditions. Houston's extreme weather swings, from flooding rains to severe drought, create perfect conditions for Hypoxylon. The fungus is actually present in most live oaks all the time, but it only causes disease when the tree is stressed and weakened. Hypoxylon symptoms are distinctive and unmistakable once you know what to look for. The bark on the trunk or major branches starts to peel or slough off in patches. Underneath the peeled bark, you'll see a dusty, powdery substance that can be silvery gray at first, then turns brown or black. This is the fungal spores. The affected areas feel soft or punky when pressed. As the disease progresses, large sections of bark fall off, branches die back, and the tree declines rapidly. Hypoxylon is essentially the tree's death announcement. By the time you see the characteristic fungal growth, the tree is already severely compromised. Here's the hard truth about Hypoxylon canker. There is no treatment once the fungal growth appears. The tree is dying or already dead at that point. The disease has compromised the structural integrity of the wood, making the tree hazardous. Trees with advanced hypoxylon should be removed because they're likely to fail and fall. The wood is weakened and dangerous to leave standing. The only way to deal with hypoxylon is prevention through stress reduction. Water your live oaks deeply during drought periods, especially Houston's brutal summer droughts. Mulch around trees to retain moisture and moderate soil temperature. Don't wound trees or damage roots. Avoid soil compaction around tree root zones. Don't pile soil against tree trunks or change grade near trees. Basically, keep your live oaks healthy, and they're far less likely to succumb to hypoxylon. A healthy, vigorous live oak can resist the fungus even though it's present. A stressed oak is vulnerable. If you see bark peeling on your Houston live oak, call an arborist immediately. Early intervention with stress reduction might save the tree if caught before major fungal growth appears. Once you see the dusty spores, start planning for removal because that tree is a hazard. Third disease, bacterial leaf scorch. This is caused by a bacterium called Xylella fastidiosa that clogs the water-conducting tissues of the tree. It's transmitted by insects like leafhoppers and spittlebugs. Bacterial leaf scorch is not as immediately fatal as oak wilt, but it's incurable and progressively weakens trees over several years until they die. Symptoms of bacterial leaf scorch start with leaf margins turning brown, creating a scorched appearance. The browning typically starts in late summer and affects random branches throughout the canopy, not just one section. Leaves may show yellowing between the veins before turning brown. The pattern of symptoms is scattered through the tree rather than confined to one area. Over time, affected branches die back and the canopy thins progressively. The tree declines slowly over 3 to 7 years typically. Bacterial leaf scorch is diagnosed through lab testing. Leaf samples are sent to plant diagnostic labs where they test for presence of the bacterium. Visual symptoms alone aren't definitive because they can look like drought stress, root problems, or other issues. If you suspect bacterial leaf scorch, get laboratory confirmation. There is no cure for bacterial leaf scorch. Once infected, the tree will slowly decline. Management focuses on keeping the tree comfortable and safe as long as possible. Supplemental watering to reduce water stress. Pruning out dead branches to maintain appearance and reduce hazard. Fertilization to maintain vigor. Insecticide treatments to reduce insect vectors, though this doesn't cure the disease. Eventually, as the tree declines significantly, removal becomes necessary. The decision with bacterial leaf scorch is usually how long to keep the tree versus when to remove it. A slowly declining live oak might provide years of value and beauty before reaching the point where removal is needed. Work with an arborist to monitor decline and make decisions about timing. Fourth disease, Anthracnose. This is a fungal disease that causes leaf spots, defoliation, and twig dieback. In Houston's humid conditions, anthracnose can be a recurring problem on live oaks, especially during wet springs. While anthracnose rarely kills mature trees, it can significantly weaken them and make them vulnerable to other problems. Symptoms of anthracnose include irregular brown spots on leaves, often starting at leaf edges or tips. Spots may have yellow halos. Leaves may curl, wilt, or drop prematurely. Twig dieback, where small branches at the ends of limbs die back. This creates a thin, sparse appearance to the canopy. The disease is most severe during cool, wet weather in spring. Anthracnose is manageable with proper care. Rake and remove fallen leaves to reduce fungal spores. Prune out dead twigs and branches during dry weather to improve air circulation. Apply appropriate fungicides during early spring if the tree has had severe anthracnose in previous years. Improve overall tree health with proper watering and fertilization. A healthy tree can outgrow anthracnose damage each year. For Houston live oaks, anthracnose is more of a chronic annoyance than a death sentence, unless the tree is already stressed by other factors. Combined with drought, root damage, or other diseases, anthracnose can contribute to serious decline. Manage it as part of overall tree health program. Fifth disease, root rot, particularly from armillaria fungi. Root rots attack the root system and lower trunk, slowly killing the tree by destroying its ability to take up water and nutrients. In Houston's often wet, poorly drained soils, root rot can be a significant problem for live oaks. Symptoms of root rot are often subtle until the disease is advanced. General decline, thinning canopy, smaller leaves, early fall color. The tree just looks unhealthy, but there's no obvious cause. In advanced stages, mushrooms or fungal fruiting bodies appear at the base of the tree or on roots. The tree may develop a lean as roots decay and lose structural support. Bark at the base may be loose or peeling. Diagnosing root rot requires careful examination of the root system and often lab tests. White fungal growth may be visible under the bark at the root collar. Roots may be soft, dark, and rotten instead of firm and white inside. The tree may have a sour or mushroomy smell at the base. Root rot is extremely difficult to treat once established. There are some fungicide injection treatments that may slow progression, but rarely cure advanced infections. Management focuses on improving drainage, avoiding wounds to roots and lower trunk, not piling soil or mulch against the trunk, and maintaining overall tree health. Many trees with root rot must eventually be removed as they become hazardous. Prevention of root rot is much easier than treatment. Plant live oaks in well-draining locations. Don't plant them in low spots where water stands. Don't overwater. Live oaks are drought tolerant and don't need frequent watering once established. Don't change soil grade around established trees. Adding or removing soil can damage roots and increase rot risk. Protect roots during construction and avoid wounding the trunk or root collar area. Now let's talk about how to protect your Houston live oak from all these diseases. Start with a professional assessment by a certified arborist. They can identify early signs of disease and stress that you might miss. Do this annually, especially for large, valuable live oaks. Early detection is everything. Maintain optimal tree health. Healthy trees resist disease better and recover faster when they are affected. Water deeply during droughts, but don't overwater. Live oaks need maybe 1 inch of water every 2 to 3 weeks during dry periods, not daily watering. Mulch around the tree with 3 to 4 inches of organic mulch, keeping mulch away from the trunk. This moderates soil moisture and temperature. Avoid wounding the tree. Don't nail things to the trunk. Don't let lawn mowers or string trimmers hit the bark. Don't damage roots with digging. Every wound is a potential disease entry point. Never top or heavily prune live oaks. This stresses them and creates massive wound areas. Follow proper pruning timing. Avoid pruning February through June to reduce oak wilt risk. Prune during dry weather to reduce fungal disease spread. Address stress factors promptly. If construction is happening near your live oak, protect the root zone with fencing and hire an arborist to supervise. If drainage problems develop, fix them before the tree suffers. If drought is severe, provide supplemental water. Don't wait until the tree shows obvious decline. Know what's normal for your specific tree. Take photos annually so you can compare year to year. Live oaks naturally drop old leaves in spring as new leaves emerge. This is normal. But unusual leaf drop, browning during summer, or rapid changes are warning signs. Document changes and call an arborist when things don't look right. Understand that old live oaks eventually decline and die. Trees don't live forever. A live oak showing disease at 80 or 100 years old may be reaching natural lifespan. The question becomes managing its decline safely rather than trying to cure it. Consult an arborist about timing of removal for old, declining trees before they become hazards. Real example from River Oaks area of Houston. Historic property with a massive live oak estimated at 150 years old. Owners noticed some leaf browning in one section. Called arborist immediately. Testing confirmed early-stage oak wilt. Aggressive treatment with fungicide injection, root barrier installation, and removal of affected branches. 5 years later, that tree is still standing and healthy. Early detection and immediate action saved a priceless tree. Contrast that with a Sugarland homeowner who noticed their live oak thinning out over a couple years, but didn't call anyone. By the time they had an arborist look, the tree had advanced Hypoxylon canker and root rot. Tree was structurally compromised. Had to be removed. Cost $5,000 for removal. If they'd addressed the tree's stress earlier, might have saved it. If you're concerned about disease in your Houston live oak, don't delay. Call 877-454-7964 for certified arborist evaluation. We'll inspect your tree, identify any diseases or problems, recommend treatment if available, and give you honest advice about prognosis. We serve all of Greater Houston, including Katy, Cypress, Spring, the Woodlands, Sugarland, Pearland, Humble, and Kingwood. We have experience diagnosing and treating all the major live oak diseases. We can save trees when caught early, and we'll tell you honestly when a tree is beyond saving. Subscribe to this channel for more Houston tree disease and care information. Drop a comment if you have questions about your live oak's health. And remember, these iconic trees are worth protecting. Early detection and proper care can add decades to their lives. Pay attention, act quickly, and don't let preventable diseases kill your valuable live oaks. Thanks for watching, Houston.